This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Known as the cancer of the blood, leukemia is one of the most fatal diseases in the Philippines today, according to the Department of Health or DOH. It can affect people of all ages, though most sufferers are children. According to the Manila-based NGO Cancer Warriors Foundation Incorporated, there are currently 3,500 cancer cases in children younger than 15 each year in the country.
Well, it can occur at any age. It can occur to both males and females. Childhood leukemia, particularly acute lymphoblastic leukemia, peaks between 2 to 5 years old.
The telltale signs of leukemia can differ from person to person, but the most common ones include persistent fatigue and body ache, fever, repeated nose bleeding, and weight loss.
Usually, leukemia presents with anemia, namumutla. It leads to easy bruising, and therefore you can see some hematomas, bleeding gums, bleeding nose.
While most medical experts still have not identified the exact causes of the disease, most point to both family history and environmental factors such as exposure to certain chemicals and radiation. And while there's so much to learn and understand about leukemia, most doctors believe that screening methods and other diagnostic exams are important for them to have a window of opportunity to help those who are affected by the disease. What are the different types and classifications of leukemia? Is leukemia a preventable disease? All these and more tonight on MedTalk.
And joining us tonight is Dr. Amurao-Abiera, a pediatric hematologist, oncologist, and a consultant of the Cardinal Santos Medical Center and the Philippine Children's Medical Center. Also with us is Dr. Edwin Rodriguez, Faculty Secretary of the UST Faculty of Medicine and Surgery and pediatric hematologist from the University of Santo Tomas Hospital and Cardinal Santos Medical Center. You may join our discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening.
Tonight we'll get to understand the cancer that is leukemia. And leukemia is the cancer of the blood cells. So let's first understand how normal blood cells form. Dr. Marilu.
Okay, blood cells are formed in the bone marrow. So the bone marrow is the organ where hematopoiesis takes place. Hematopoiesis is the medical term for blood formation.
Thank you.
Okay, so it starts from a single cell. So within the bone marrow, it starts from a single cell we know as stem cells. And the stem cell has the capacity to divide and to mature. So in essence, it is able to renew itself. And in the course of its division and maturation, it gives rise to the different cell types in the bone marrow, namely your erythrocytes or your red cells, your, your white cells, which is composed of your lymphocytes and your granulocyte series, and your platelets. Now, each of these blood components or blood elements perform several functions. The red cell gives the redness in the blood. It carries oxygen into the different parts of the body. And the platelets is very much important for clotting mechanism. The white cell is considered to be the defense mechanism, the police of the body. The neutrophils actually is the first agent or the first cell that will try to what is this? To fight bacteria, invading bacteria. The lymphocytes are cells that produces antibodies.
So you've mentioned each special job of the white blood cells, the platelet, and the red blood cells in relation to normal blood cells and how they form. Now, when we mention leukemia, what happens to the red blood cells, the white blood cells, and the platelets? What kind of job are they not able to perform in our body, Dr. Edwin?
Leukemia actually is a disease of the bone marrow. Ito ay sakit ng bone marrow na siyang gumagawa ng iba't ibang klase ng dugo na nabanggit ni Dr. Abiera. At sa leukemia, nagkakaroon ng isang klase ng abnormal na puting dugo na pumapatay sa pulang dugo, sa mga normal na puting dugo at sa platelet. At dahil dito, hindi nakakagawa ang bone marrow ng isang pasyenteng may leukemia ng puting dugo, pulang dugo at platelets. And therefore, the manifestations now will be in the form of anemia or pallor, which we see in our patients because of the absence of red blood cells, easy bruisability or bleeding because of the absence of platelets, and prolonged infection or mouth sores as a result of the absence of normal WBC. Simply put, the bone marrow is hostaged by an abnormal cell that prevents the other normal cells from being produced, and therefore signs and symptoms of bone marrow failure can be seen in patients with leukemia.
Now, you mentioned the signs and symptoms that can be seen in a patient who has been diagnosed with leukemia. You mentioned bruising.
Right.
Can it mimic other diseases or illnesses, the bruising that we see in a leukemia patient?
Oh yes, bleeding is a non-specific sign, no, and symptoms. Actually, it can mimic your ITP, immune thrombocytopenic purpura. It can mimic a simple vascular problem like scurvy. It can mimic hemophilia. No? So, not unless seen and examined by the doctor, then leukemia can be one of the option or the consideration in a bleeding child.
So you really have to seek the help of
Yes.
your medical doctor. You cannot just base it on the sign and the symptom that you see, the naked eye, no? Talagang dapat under a microscope, which leads us to the common types of leukemia. I understand that there are 4 common types of leukemia. Please tell us about this, Dr. Edwin.
The different types of leukemia can be classified based on the predominant type of abnormal cell. Ano ba ang abnormal na cell, no, sa isang batang o sa isang matandang may leukemia? So kung ito ang pagbabasihan, pwedeng ito ay lymphoid leukemia or myeloid leukemia. At kung ang pagbabasihan natin ay yung bilis o tagal kung kailan nagkaroon ng leukemia ang isang bata o matanda, ito ay maaring sabing acute kapag sa loob ng isang linggo o isang buwan, mabilis na nagkaroon ng leukemia, o chronic kapag mahigit 6 na buwan bago tuluyang nalaman na may leukemia. So, in essence, there are 4 different types of leukemia: acute lymphoid, acute myeloid, chronic lymphoid, and chronic myeloid. Kaya po 4 ang sinasabing common na classification o uri ng leukemia.
And these 4 classifications, gaya ng nasabi niyo na, Doctor, iba-iba sila, no?
Opo.
Pagka na-manifest sa isang pasyente na may leukemia.
Ang acute leukemia po sa pangkalahatan ay mabilis, biglaan at progressive. At kung minsan hindi maipaliwanag ng magulang o ng doktor kung bakit ang kanilang anak na nagpasa lamang o namutla o di kaya ay naglagnat ng mahigit 1 o 2 linggo ay may leukemia na. Ang chronic leukemia naman po ay steady, stable sa mahabang panahon na kung minsan hindi natin malaman na may leukemia pala ang pasyente o ang tao maliban na lamang sa aksidenteng pagkadiskubre sa isang routine na blood test o routine na check-up. Subalit ang kaibahan ng acute at chronic leukemia ay ang chronic leukemia po sa katagalan ay nagbabago ng anyo at nagiging acute leukemia na mahirap gamutin.
Ang acute leukemia, from chronic to acute, no?
Opo.
Humihinto ba ito at chronic at hindi na nagiging acute at some point, Dr. Marilu?
Acute to chronic, hindi ho nangyayari yan.
Vice versa, chronic to acute, na
The
humihinto na
chronic
siya.
leukemia can evolve into acute. no? Pero hindi the other way around. No? Sa bata, ang pinaka-common na leukemia actually is acute lymphoblastic leukemia.
What exactly is ALL?
Oo. Gaya ng nasabi ni Dr. Rodriguez, no? The predominant abnormal cells ay yung mga lymphoid origin or yung lymphocytes. Pag sinabing acute myeloid leukemia, the predominating malignant cells are the myeloid cells. Ito yung cell na give rise to red cell, to white cell, at to platelets. So, myeloid yan. Sa mga bata, usually AML is more common 2 or less, 2 years old and less, or sa teenager. So, in between, ALL is the most common. At saka nagpipik nga yan ng edad ng mga between 2 to 5 years old.
Why is it na yan ang peak between 2 to 5? Why are children most affected by ALL, this type of leukemia? Dr. Edu?
I don't think there is an exact explanation why children tend to be affected by ALL more often. But in children, it is the most common type of cancer or malignancy. So I don't think it's entirely true to say that children are mostly affected, except that for ALL, it is really children who are affected. So with regards an exact explanation, probably there is none. But ALL is the most common childhood leukemia and most common childhood cancer in the world.
Based on the video earlier, no, we played in the program, 3,500 cases of children are affected with this type of leukemia. That's an alarming number. That's a high number.
And the reason is because more patients are aware that there is such a thing as leukemia and that there is treatment for leukemia. I think that's the reason why there is a sudden increase in the number of reported cases. Unlike in the past when leukemia seems to be a stigma disease, meaning you don't want to claim that your child has leukemia, modern day individuals have more access to information about leukemia and are more aware of the early signs and symptoms, and therefore they get reported.
Yes, Dr. Marilu, you'd like to add to that?
And also because the awareness already of the the awareness of the health professionals, no? There are a lot now of doctors who go into hematology and oncology. So there are trained specialists to diagnose the disease. Plus the fact that there is much improvement in technology for the diagnosis of this disease.
Which is good to know, good to hear, and the parents also are more vigilant. They're more aware of different behavior in their child, a different, maybe like what you mentioned, no? Yung kunyari, may nosebleed na walang provocation, or a bruise na walang provocation, which leads us to talking about the signs and symptoms of leukemia. But we'll talk about that when MedTalk returns.
If you want a diet that can combat leukemia, then you must have lean protein, a good balance of fruits and veggies, milk, some fats, and whole grains. But also remember that food preparation is key, so make sure that the food is properly cooked and consulted with your doctor.
We're back here on MedTalk, still talking about leukemia. This time, let's talk about the signs and symptoms and the risk factors that can increase a patient or a person getting leukemia. Let's start with Dr. Marilu.
Okay, as it has been said a while ago, the signs and symptoms relates to the disturbed function of the bone marrow. So, pallor, pamumutla, again, no? Easy bruisability. Remember that leukemic cells are infiltrative cells. Therefore, it gives rise to big liver, big spleen, big lymph nodes. Can also present as arthritis, bone pains in children. patients can also present with recurrent infection, no? Prolonged fever. So, so if you can see, signs and symptoms of leukemia are actually non-specific.
You mentioned anemia. Isn't it common in children and teenagers that they have anemia at that age? And how will we know if it's anemia or leukemia?
Well, you're right, no? The most common cause of anemia in children is nutritional. But the thing is, anemia that does not correct with simple measure, and it has been recurrent, and it's anemia that goes that will need transfusion, associated with other signs with bleeding, with fever, weight loss, then we have to think of a more severe and more life-threatening condition like cancer or leukemia.
How about the bleeding? Is it profuse bleeding? Is it often? Should it be triggered by something? Like now it's summer. It's common among children because of the heat to have a nosebleed or to get a nosebleed. How do we distinguish between the two?
Bleeding in leukemia is due to the abnormal function of the platelet. Actually, the abnormal number or even the absence of platelets as a result of the abnormal white cells impinging on the bone marrow. Now, in leukemia, the bleeding may be an isolated finding in the beginning, but since it is a systemic illness, there will be additional signs and symptoms to the bleeding. Now, bleeding during summer, especially in the presence of a family history like a mom or a dad or a brother or sister with a similar bleeding problem, is a different problem. It's a bleeding disorder, but is usually benign and does not necessarily require aggressive treatment. But the bleeding in leukemia can be very severe and life-threatening. It can happen even without provocation, even without trauma, especially if the platelet count is very low. So it may mimic other diseases, but there are additional signs and symptoms that will increase the index of suspicion of a doctor in a patient who he thinks has leukemia.
You mentioned the word increase. How about the risk factors that increase a person getting the disease?
Oh, yes. Actually, a lot of patients would ask, a lot of the mothers would ask, paano ho ba nakukuha yung leukemia? And our answer would always be, even the modern day researchers could not really explain why children develop leukemia. But there are certain factors that increase the likelihood or the incidence of developing leukemia. That is exposure to too much radiation, exposure to chemicals like benzene, genetic predisposition, certain inherited diseases like, for example, Down syndrome. Down syndrome has an increased incidence of developing leukemias. And other hematologic diseases, like, for example, where they are not very common, no? Like mga Fanconi anemia or any other diseases characterized by other chromosomal aberrations.
Let me add that environmental factors like exposure to, say, aflatoxins or asbestos can increase the possibility of associated leukemia. Viral infections, no, can be associated with some forms of malignancy, probably not necessarily leukemia, but some other forms of solid tumors. And cancer treatment. The chemotherapeutic agents are themselves carcinogenic, meaning they have the potential to produce a secondary type of cancer years after you have treated successfully say, a leukemic child. So these conditions are risk factors that can increase the likelihood of a person to develop a specific form of leukemia.
But we've mentioned also that it is more common in children.
Right.
But the radiation or exposure to other chemicals, children are not exposed at a very young age to all of these things. So why is it that they're most prone to it, or that they get it more than the adults?
Well, I think the most logical explanation there is the genetic predisposition, or the increased likelihood of a family or a child from a family who has had histories of cancers in different forms affecting their members or their family members. In fact, that is the most common explanation, that there is a predisposition, and then a second trigger unleashes now the potential for cancer development.
Because as a parent, you really want all these answers. You know, you have all these questions, and hopefully all these questions are answered according to how you would like to hear them.
Yeah,
right,
it's so
Doctor?
unfortunate na the exact cause, the exact mechanism why children develop leukemia is really not known. But he said, no, about the leukemia starts with a genetic mutation. No, but you need a second hit or a second mutation before there's an expression of the disease.
Doctors, we have a caller on the line. We have our first caller on the line, Nene. Hi, Nene. Good evening.
Good evening.
Please go ahead with your question.
Actually, yung question ko is, ano yung pagkakapareho or pagkakaiba ng Hodgkin lymphoma o dun sa leukemia? Or may pagkakapareho ba?
Salamat, Nene. Dr. Marilu.
Leukemia is the cancer that starts from the bone marrow, while Hodgkin's lymphoma is the cancer that starts from the lymph nodes. Now, there's what you call also lymphoma, non-Hodgkin's, na eventually can invade the bone marrow. At kapag dumami siya ng dumami, eventually nagiging acute leukemia.
May symptom din. Nene, you're still on the line, no? Hello,
Yes.
Nene? Oo. May symptom din, doctor, ng lymph nodes, di ba?
Yes.
Sa leukemia. So,
Nag-overlap yung symptoms eh. May mga leukemia na talagang terrible ang lalaki ng lymph nodes, no? At may mga lymphoma naman na malalaki ang ang lymph nodes, and then when you see the bone marrow, punong-puno din ng blast cells.
Nene?
Yes.
Oo.
Okay.
Any other question? May follow-up question ka ba?
Wala na. Thank you.
Maraming salamat. Doctors, yun na nga yung namimimik, no, ng ibang karamdaman, so to speak, illness, ang leukemia. How is this diagnosed kung namimimik siya ng ibang mga illnesses? Dr. Edwin?
Just like any disease in mankind, importante po ang mabusising pagtatanong, no? A careful history of what happened or what transpired prior to the first meeting of the doctor and the patient. Two, kailangan din po ng mabusising pag-i-examine. No? Talagang ini-examine po through a thorough physical examination ang mga pasyenteng pinaghihinalaang may leukemia. And then of course, with the constellation of signs and symptoms, now we request for some basic blood tests which can help us confirm our suspicion. A complete blood count with platelet count and a peripheral blood smear can help us identify the abnormalities in the red cells, white cells, and platelets. And if in the blood smear, which is a stained preparation of the patient's blood, we see abnormal or suspicious immature-looking cells or blast cells, then we can now be more or less certain that this particular patient has acute leukemia.
Aside from the extraction or the examining of the blood cells, what other diagnostic tests?
So
do
as
they
soon as a
perform?
blast cell has been seen sa peripheral smear, so the hematologist would ask for a bone marrow examination.
So you have to go to a hematologist, just not a general doctor, or
I think generalists may have some discomfort handling a blood problem, and in most cases, when they see something abnormal in the blood test, they easily, just send them to the hematologist because
Yes.
he can help us or she can help us. So I think blood problems is something that a generalist would want immediate help with, and therefore they eventually land to us, no, and
hematologist.
they're taken care of us.
Dr. Marilu, going back to
So the bone marrow
the bone marrow,
examination.
yes.
So the hematologist will perform a bone marrow aspiration and get a small amount of blood for smear. And this is going to be stained and observed under the microscope. So in essence, the hematologist can diagnose it through morphology, what she sees into the microscope. So she sees a lot of abnormal leukemic cells. And then she might also get some blood for flow cytometry
What does that mean? What is
Well,
flow cytometry?
flow cytometry is a procedure wherein the cells, the bone marrow cells, are examined by a machine called the flow cytometer.
Okay.
And usually, the type of leukemia is confirmed, no? Whether it's an acute lymphoblastic, acute myeloid, and also the phenotype of the ALL, like whether it's an ALL B cell or an ALL T cell. Also, the hematologist can request for cytogenetics, meaning to say she can send the specimen to the lab to examine the cell, to culture the cell, the abnormal cells, to look for some chromosomal abnormalities. Now, there are so many modalities already for diagnosis. No? So one is peripheral blood smear, bone marrow smear, flow cytometer, cytogenetics. So in taking all of the results, the results will help the hematologist plan for the treatment and also prognosticate. Meaning to say she is able to tell whether or predict a good outcome following a certain treatment.
So once you, let's say a patient or a person has been diagnosed or confirmed to have leukemia, how do you move forward from that? What are the next steps to take?
Well, after the initial shock, I
Yes.
think
Yes,
the
sadly.
initial denial
Yes.
for most parents, we just have to keep on telling them over and over again what leukemia is until it sinks in deeper. And then we sit down when they have already more or less come to terms with the diagnosis, which is a very sad diagnosis for any physician and for any parent, and then plan the treatment, which means giving the necessary drugs, supportive blood transfusion, antibiotics if needed, and then even the counseling and the family support mechanisms that may be needed to help this child go through the treatment process for leukemia.
It may be a sad diagnosis rather, it may be a shock
All right.
to everybody, but on a positive note, there is treatment, there is help, and you can get well from leukemia, I understand, yes.
For the pre-B ALL or the childhood ALL, survival rate in the first world countries can be as high as 90%. But in a forever developing country like the Philippines, our success story can be as good as 75 to 80%. And we're talking about cure and not just event-free survival. So the prognosis or the outcome really depends on the type of leukemia. Even if it is ALL, there are some types that confer a poorer, grimmer outcome, which despite treatment may also spell death.
But fortunately,
Yes, doctor.
the what's this? Leukemias that are not that tend to have bad prognosis are very rare. Most of them are the pre-B type or those that belong to the good prognostic type. So, in fact, acute lymphoblastic leukemia in childhood is a good example of the victory over cancer, because it is already treatable. In the 1970s, the overall survival is less than 20%. So right now, with the current treatment technology, we are achieving actually 87% based on our statistics.
That's very
So
good to
that's
know. That's
good
the
enough.
positive note
Right.
Yeah,
that you're looking
very
for.
positive.
Doctors, we have a question this time from Facebook. Is G6PD on children also related to leukemia, or can it also relate to leukemia? G6PD. What exactly is G6PD first?
G6PD is a congenital type of hemolytic anemia, meaning there is premature destruction of red cells resulting to pallor or low hemoglobin, low hematocrit, and low red blood cells in children. It is a different disease entity from leukemia, although both may appear with pallor. One is not very life-threatening while the other is. And the modes of treatment are also different. So they do not necessarily mean the same thing, and they are two different disease entities involving the red cells.
Okay, doctors will talk more about leukemia when MedTalk returns.
Like most kids, Sevi has always been an active and playful child. He is his parents' ray of sunshine. So it is almost impossible to believe that Sevi had leukemia when he was 3 years old.
We noticed that he was losing weight as the days would go by. And then, of course, he was complaining of some pain in the hip part. So we thought probably he's just fighting some virus or some illness, which is pretty common for children at that age.
Sevi had coughs and colds for prolonged periods of time, even with antibiotics.
It was in the CBC that the hospital found out that his hemoglobin, his blood counts were very low. And of course, they had to do some further tests to really rule out all of these things.
Medical tests revealed that he had acute lymphocytic leukemia. For nearly 3 years, Sevi went in and out of the hospital for treatment.
We had to actually be in the hospital every other day for constant CBCs, for the chemotherapy. So the first 3 to 4 months of the protocol or of the treatment, we had a second home, which was the hospital.
In 2005, he underwent a procedure at the Philippine Children's Medical Center. This was the time when his parents, Paul and Sigrid, noticed the sad plight of numerous charity cancer patients. This led to the creation of Brave Kids, a volunteer group initially composed of Sevi's family members and his parents' friends and co-workers.
Their funds were available with their own eyes, how children go through painful procedures without anesthesia. And this left us with so much, shock, with so much pain.
Now fully recovered, Sevi is a living proof that the battle against leukemia can be won.
We're back here on MedTalk, still talking about leukemia. You may join our discussion by calling our hotline at 548-4678. Sevi, looking very well and active and malikot, just like any other little boy. But he was diagnosed when he was 3. And it was a shock to his parents. In the video, it was such a shock because at such a young age, and you don't expect your children to fall ill with something like that.
Usually parents, once their children are diagnosed with leukemia, ang unang reaction niyan, hindi makapaniwala. Doktora, ang bata-bata, bakit may leukemia? Those are the most common questions that they will ask. No? And then, ang isa pa is that it's so sudden. Isang linggo lang na nilalagnat, bakit leukemia na ngayon? So, it's really very difficult for them to accept, initially, what had happened to their children.
So parang the shock, and then acceptance, and then
may denial pa yan.
May denial, and then understanding what it's all about and moving forward. In Sevi's case, his mom was sharing with us that he was diagnosed with ALL, which we've been talking about during the course of the show. And he had hip pains, arthritis in children. I was wondering, baka naman in adults lang arthritis, pero pala in children meron din.
Yeah. There's such a thing as juvenile rheumatoid arthritis in children, which in fact can be mistaken as acute lymphocytic leukemia. Although the mechanisms by which the bone pain or the hip pain in Sevi's case happened are different, they can actually be mistaken as one over the other. But in acute leukemia, the hip pain is because of the expanding abnormal cells in the bone marrow that tends to overcrowd the spaces within the bone, and that's causing the severe pain.
And alert, parents, you're up 24/7. Alert as to any little bump, bruise that's not getting well, bleeding. In this case, the pain in his hip. And sometimes children are not able to articulate how they really feel.
Yes,
it's the
that's
parents'
true.
job to speak for them, to
That's
help
true.
them out. No? Doctors, we have another caller on the line, Pinky Ocampo. Hi, Pinky.
Hi.
Hi, good evening.
Good evening, ma'am. Good evening, doctors.
Good evening.
Yeah, I'd like to ask about the success rate for any bone marrow transplant to an adult, in an adult case. Thank you.
Thank you, Pinky. Doctors?
Well, for one, we do bone marrow transplant in the Philippines, but the major success stories for bone marrow transplant are those which are related to, say, primary bone marrow problems. And I'm speaking in the pediatric age group. For the adults, I do not have the specific statistics as to how successful it is, but I am sure that there are some indications for bone marrow transplant in adult in which it is successful. Because for adults, bone marrow transplant can be both for blood-related indications or non-blood related indications. And in both segments of indications, I think there are success stories and success rates. But the exact figure, I'm sorry, I cannot give it at the moment.
Okay, Dr. Pinky,
Yes.
any other question?
Oh, thank you very much. That's about it. Thank
You're
you.
most welcome. Thank you for calling.
Thank you very much. Good night.
Good night. Bone marrow transplant. In children who have been diagnosed with leukemia, do they have to get the transplant from a family member, or can it be someone who's just compatible when it comes to their blood? How does that work? How does that go?
Bone marrow transplant is reserved for those cases of refractory disease. So it is not the first or the initial line of treatment for acute lymphoblastic leukemia in children. And usually, it's just like you need to have a donor who is perfect match with you. Of course, your perfect match will be your twin. No? I'm not really a bone marrow specialist, but I think you need to have a tissue matching. You are the patient and the donor.
Okay. And of course, that holds true also for adults. Tissue
Yes.
matching
Right.
and
for any
the
form
transplant.
of transplant, organ transplantation for that
You
matter.
need to have matching.
Okay. Doctors, how about care? Oh, we were talking about Sevi, who's now I think 8 years old, if I'm not
Right.
mistaken. 8. The care that went into making sure he is well, he's able to function as a child growing up. What kind of care goes into someone who has been diagnosed with leukemia?
I think leukemia requires a multidisciplinary type of management that will take care not only of the disease, but even of his nutrition, even of the pain that may come with the procedures or with the disease itself, with the psychosocial, mental, emotional. And I think if I remember right, Sevi belongs to a very religious family. They are devout Catholics, highly spiritual, and I think that helped Sevi in his journey to conquer leukemia. So going back, it's a multidisciplinary approach to treat leukemia, both during the active phase of the disease and during the treated phase of the disease.
And the support group of the family and friends around the patient is
It's
of
very
utmost
important.
importance.
It's very important, no? Remember, Dr. Rodriguez said that, emphasized that leukemia, children with leukemia should be treated by a multidisciplinary team in a specialized center, where the people are competent, where the staff are competent to manage this kind of diseases. Now, aside from the medical aspect, I think the most important thing is helping family to cope up with this particular condition, no? Because it's a life-changing event, no? It changes patient, it changes the people around him. Imagine a child has been active now down with life-threatening illness, and therefore there's disruption of his normal activity. So it brings a lot of psychosocial problems that needs to be addressed as well. And the role of the family, the role of support group, families that experience the same, would tend to help these affected families cope up with the complications of treatment as well as with other medical issues.
Doctors will go to the support group. Which support group helps families and patients with leukemia? But first, let's answer our Facebook question from Seth Mar. I have a relative who passed away because of leukemia. Will it mean that I am predisposed to have one as well due to heredity? I experience certain bleeding, nosebleeds, and anal bleeding at times. Wow. Doctors.
Well, as Dr. Abiera has mentioned, there are some inherited diseases or conditions or syndromes that can predispose to leukemia. But it does not necessarily mean that if you have a relative who died of leukemia, that you will get leukemia yourself. Although the risk is high because of the hereditary or the genetic predisposition, it does not necessarily follow. Now, with regards to his or her clinical manifestations of bleeding in the nose and the anus,
Yes.
I think he should probably see a doctor and try to find out why those bleeding episodes are happening. It may point out to a primary blood problem, or it may be due to something else in which the blood is involved and not necessarily leukemia.
Okay, kasi sometimes, no, now that we're talking about it, because it's a blood problem, it's a
Right.
blood disease, you automatically link it
Yes,
to leukemia when it
Yeah.
may not be that.
that's right. Yeah.
Doctor, so you mentioned the support groups that the families must seek or belong to,
Yeah.
for the lack of a better term, belong to when when the family member has been diagnosed with leukemia. What are these groups, and how do these groups help the patient and family members cope with the disease? Dr. Maria?
Well, some of my patients had become members of the Cancer Warriors. Our hospital now, PCMC, is organizing our families. Some of our parents as well can I mention it, Hospital ng Maynila, have organized themselves. And you know, it makes my job of explaining to newly diagnosed patients easier when they are around, because they are able to relate, no, to the condition or to the current situation of the patient, no. So support group is really very essential. Gaya ng sinabi natin, it's the psychosocial aspect. Hindi ka nag-iisa, andito kami. Naramdaman namin, we were once like you, ganito namin ginawa ito, ganito namin napaglabanan ito. And they're able to share their experiences.
Gaya rin ng family ni Sevi. Sinasabi ng mami niya, si Ingrid, na now they are advocates in helping, just as you mentioned, no, in helping other family members cope, understand, and accept what has happened to their
In fact,
child or adult.
I think they started their own support group, I think, which is also based at the Philippine Children's Medical
Brave
Center,
Kids.
Project Brave Kids. And this was inspired by the Perez's experience with the treatment of Sevi. And they started sharing their experience and engaging others to do the same to help the less fortunate victims of childhood leukemia.
Doctors, another question from Facebook. I'm worried that my 8-year-old son can't survive chemotherapy. What can I do to help him?
Well, as a rule, chemotherapy drugs are not the safest drugs. In fact, they can be fatal at times because of the very aggressive mechanisms by which they tend to destroy cancer cells. But we have to remember that we are after the beneficial effect of the drugs and not much the adverse effects or the side effects which may be present as a result of treatment. Well, we have to continue chemotherapy and just provide adequate nutritional support to a patient undergoing chemotherapy. Make sure that during times when the bone marrow is not very well as a result of chemo, that we prevent them from getting sick, and to be very vigilant about early signs and symptoms that warrant immediate medical attention. I think there's no reason why her kid cannot survive chemotherapy. It's also a matter of prayer and the collective effort of the family and the physician to do treatment.
Sometimes a mother's heart, no, or parent's heart, when you see your child in pain or suffering, you might think, baka nata-transfer mo yung how you feel, no, that the child can't. But as you mentioned,